According to Statistics Canada, food insecurity is the inability to acquire or consume an adequate diet quality or sufficient quantity of food in socially acceptable ways, or the uncertainty that one will be able to do so. A child is considered food insecure if the family respondent claimed that his or her family did not have enough food to eat on a regular basis. In 2012, 1.15 million children lacked guaranteed access to sufficient food due to a lack of funds. In 5 short years, in 2017 to 2018, food insecurity among children in Canada increased to an estimated 1.25 million. The COVID-19 pandemic has exacerbated food insecurity in Canada, with 1 in 3 children going hungry, compared to 1 in 4 children before the pandemic.
Today's topic will cover the impact of food insecurity in elementary school children. According to research, food insecurity puts a child at an increased risk of developing behavioral issues, such as hyperactivity, lack of self-control, having a hard time focusing, and antisocialism, thus resulting in lower academic performance.
Inadequate education as a result of food insecurity increases a child's risk for adverse health outcomes later in life. Impoverished primary education has been linked to a decrease in post-secondary graduations, lower income, unemployment, inadequate housing, poverty, and an increased prevalence of disease. Some of the most prominent physical ailments in children caused by food insecurity include an increased risk of obesity, diabetes, and chronic diseases. These health maladies are a result of inconsistent eating patterns and poor quality of foods, such as those high in sugar, cholesterol, and trans fats. Concerning the effects of food insecurity on a child's mental health, they are more prone to suffering from depression and anxiety due to negative coping habits and social exclusion. The 3 pillars of food insecurity provide the foundation to becoming food secure. Ensuring that children have access to food utilization, accessibility, and availability provides them the foundation to become food secure. These issues should not be taken lightly, as food insecurity influences the quality of a child's life and poses real challenges to their livelihood.
Food insecurity has serious physical, psychological, and social impacts on individuals, households, and communities. These implications affect the potential for development of a society. Physical manifestations can appear as a lack of focus at school and a reduced work ability at home or at work. Psychological symptoms of a lack of access to food, on the other hand, may trigger a strong sense of being forced to go against established standards and values, as well as a great deal of stress in the household. This has a social familial impact due to disrupted household dynamics and skewed food procurement and management methods. Such repercussions of food insecurity can be a threat to harmonious life in a community. For instance, if a larger proportion of the community suffers from food insecurity, the quality of life in that community will substantially decrease. The economy will suffer as a result of fewer jobs, less community-based programs, and worse health services. Furthermore, if this exists on a large enough scale, it could intensify conflicts in society. For instance, this could lead to market disruptions, which could lead to further decreases in food availability and greater disruptions. This could further lead to involuntary migrations and an increase in chronic diseases, which ends up straining the hospital system. This sets in motion a vicious cycle in which food insecurity contributes to a decline in access to high-quality food, which leads to increased stress and unemployment, which further leads to chronic diseases and health problems, rising medical costs, and financial strain.
This is an important topic to discuss, as food insecurity in adults and even communities can all be traced back to being food insecure as a child. Proof 2020. Therefore, a youth-targeted intervention can prevent these social stressors and burden of disease from ever developing later in their adulthood. If children grow up with adequate access to healthy foods, they are far less likely to become food insecure as an adult. Ostinger 2017. Additionally, investing in a national program to combat childhood food insecurity will drastically reduce stress on a healthcare system at the national and individual levels in the future. Sassy L. 2019. In Ontario, the average cost of healthcare in a severely food insecure home was $3,930 per year, while the cost of healthcare in a food secure home was $1,608 per year. This was attributed to the rise in the number of prescription medications, surgeries, emergency room visits, and inpatient services required by food insecure individuals. Proof 2017.
A video shown in class titled Jeff and Chad exemplifies the negative effects food insecurity has on young people's health, education, and future. The video compares the lives of two young men, Jeff and Chad. Jeff came from a wealthy family and was accustomed to eating nutritious home-cooked meals and lunches. Chad's family, on the other hand, has been struggling financially, so he eats unhealthy foods and only gets dinner occasionally. Chad describes himself as too hungry to concentrate in school, which his grades suffer. While Jeff goes on to succeed in life, Chad follows the footsteps of his mother and falls into the crisis of financial instability. He never applies to university, he works part-time with unreliable hours, and he develops unhealthy habits and negatively harm his health, such as smoking and drinking to cope with the stress of life. If Chad has children, he risks exposing them to food insecurity, poor education, and a possibility of life in poverty. Food insecurity becomes a vicious cycle that is passed down from generation to generation.
If a child does not have access to healthy food at home, we believe the next best place is at school. Schools offer an open learning environment for not only basic subjects such as English, math, and history, but also for healthy living and eating habits that children can carry into adulthood.
The intervention we'd like to propose is called the Fueled Up Dinner Program. The target audience of our intervention are elementary school children. The goal of this school-based dinner program is to provide children with nutritious meals that will help support their physical, mental, and cognitive development. A cross-national study posted in the Food and Science Nutrition Journal showed that malnourished children are at risk of poor cognitive development, behavioral problems, and poor academic performance. By supporting children with their healthy diets, we will also be assisting their learning to ensure better health and living outcomes in their future. School-based meal programs have been shown to be the most effective at targeting food insecure children because they have the ability to reach all elementary children at a national scale and across all socioeconomic classes. Furthermore, children's eating habits are more malleable than those of adults, implying that they have not yet formed very strong eating habits and can more easily be taught how to eat well. Therefore, intervening in elementary schools would be the most effective method for forming healthier eating habits. Healthy diets lay the foundation for higher education, less disease and disability, higher income, and reduce their chances of living in poverty. There are currently no nationally funded school-based food programs in Canada. We hope to change this by launching a new school-based dinner program to be accessible across the nation to any food insecure child enrolled in elementary school. Some schools have breakfast or lunch programs, but there is no literature identifying dinner-based food programs for children. A child requires at least 3 proper meals a day in order to develop physically and mentally. Our program will ensure that every child who is in need of dinner will be provided with one. The first step of our intervention is to conduct a nationwide province-based FFQ, Food Frequency Questionnaire. This self-reporting dietary tool studies nutrient and food quantity intake of students and is a way to determine which households are food insecure. The questionnaire will be sent home by the school to all parents.
to be filled out in regards to their child's diet. This questionnaire will also be filled out by the teachers themselves. Additionally, a simple school-based questionnaire will be given to all the children, asking them the following. How many times a week do you get breakfast? This can be ranked from 0 to 7, depending on how many times they have it in the week. Another one would be, do you get a packed lunch for school? Or how often do you not get one? Or perhaps when you go home, do you eat dinner every single night? Or how often do you not eat dinner? And lastly, does your hunger distract you from doing your schoolwork? Always, sometimes, or never?
The forms will be distributed to social workers who will analyze the FFQs in tandem with the children's surveys to determine which kids are food insecure. Once a child has been identified as food insecure, they will be enrolled in the dinner program. The take-home dinner consists of sandwiches, wraps, fruit and veggie platters, and other easily prepared nutritious foods. The meal will be packaged in a brown bag to avoid feelings of shame or embarrassment that children may experience if their classmates knew they were in need. Teachers will collect these bags from the staff room at the end of each day to distribute to the specific students to place directly into their backpacks. Community volunteers will come into the school after lunch to make the bags. We will require either funding from the government or the school board. In 2019, the federal government implemented a new national food policy working towards a national school food program for all provinces and territories. If funding from the government falls through, we plan to rely on school funding. We will distribute the school funds as we see fit to ensure optimal benefits for the students. We will also contact local grocery stores for further support and funding of our program.
In conclusion, our intervention creates a beneficial chain reaction that begins at the individual level within food insecure households in Canada and progresses into the health and well-being of our community. Food security promotes a healthier diet in childhood, leading to improved behavior, motivation, energy, and performance levels in the classroom. Higher performance in elementary classrooms promote further education and higher income, which is often associated with a healthier diet and positive health behaviors. The primary goal of our food-based school program was to prevent inadequate nutrition and hunger in all elementary students in Canada by addressing the 3 pillars of food security: utilization, accessibility, and availability. Our program removes the barrier of availability by providing nutritious meals to the children on a regular basis. Accessibility is ensured because our program is based in a setting where children frequently attend their schools. Finally, utilization is promoted through demonstrating to the children what constitutes a healthy meal and emphasizes the importance of eating 3 meals a day. By targeting food insecure children in elementary schools, Fueled Up implements preventative medicine through addressing food insecurity in elementary children and the many social determinants of health associated with it.
Raising healthy children is raising healthy adults and a healthy society. Brought to you by Fueled Up.